Hello, I'm Tori. Welcome to my channel. I'm really glad that you're here. Today I am going to be talking about my upcoming lumbar spinal fusion surgery. So as you know, I've been talking about my weight loss and the topic of weight loss in general. But I also want to kind of expand my channel and talk about health issues too. And so today I'm going to be talking about my health issue, which is my back pain that I've been having and my upcoming surgery. So first of all, I want to give a little background. So I am filming on a Sunday. I'm having my surgery on Thursday. So it's coming up in about 4 days. And I went for my pre-surgery visit this past Thursday, so a couple of days ago, about 3 days ago. And the things that they did at my pre-surgery visit, or they did the typical things. They took my blood pressure, they took my weight, they asked me about my medications, and then they told me which medications to take the day of my surgery. They kind of went over what would happen during surgery. They told me what my copay was for my insurance, and just kind of in general got me ready for my surgery. So as far as how I ended up having to have the surgery, what happened was that I had my car parked on the road in front of my house, and I'm from Alabama. I don't know how things are in your state, but in Alabama, so they're not very good at keeping the roads well maintained. So there was a big pothole up in front of the house by my car, and I had gone up to my car to get something out of it, and I turned around and forgot about the pothole being there, stepped in it and tripped and fell very hard, landing on my chest and face forward. And it wouldn't seem like you would hurt your back doing that, but apparently that's how I ended up injuring my back. I did fall very hard. It knocked the breath out of me. It kind of stunned me for a moment. I struggled to get back up because my back was hurting, but it wasn't hurting to the point that I really realized that something wasn't right at that point. And it took a few days later when it started really hurting, and I started having spasms in my lower back. And so I went to my primary care doctor and just told her about the pain and the fall. And she did x-rays, and then after the x-rays, she sent me for an MRI. And it turned out that I had an L3 fracture. And so, of course, I asked what they do about fractures. And the answer I was given was that there's not a whole lot you can do about them, but they will usually heal on their own within about 3 months. So they gave me some muscle relaxers and gabapentin to help with pain, and told me to come back and they would check on it again in a couple months, see how it was going. So I did that. I was still in pain. I went back a couple months later. They did the x-ray again. They did the MRI again, and the fracture had not healed. And so they did something called a kyphoplasty. And that's where they put what they call spine jacks into your vertebrae, and they jack up the vertebrae, and then they put bone cement in there. And so what happened was that when they did that, the bone cement migrated into an area of my back where it wasn't supposed to be, and it didn't really do what it was supposed to do. And so I continued to have pain. And so for about the next 2 years, or for the past 2 years, I have had physical therapy. I went and had injections into my back, and neither of those helped. In fact, the physical therapy seemed to just make it worse. The injections have made a little bit of an improvement for about 2 weeks, and then it was just right back to being how it was before. So I talked to my primary care doctor again. She referred me to a neurosurgeon. Well, I went to the neurosurgeon, and he would not do the surgery for me, even though he said that I needed to have a spinal fusion. He would not do the surgery because my BMI is over 40. And he does not do surgery on anyone whose BMI is over 40. So the reason for that seems to be that he's concerned about possible anesthesia reactions or not doing well with anesthesia because of your weight. So I asked him if he could recommend someone who would do the surgery, and he recommended an orthopedic surgeon who specializes in spine surgery. So I went to see him, and he agreed to do my surgery. He did agree that I needed to have a spinal fusion. So I'm having an L2 through 4 fusion done. And so he recommended the surgery. He said that the insurance would pay for it as long as your BMI is under 50. And my BMI is just under 50 right now. With my, I've lost a little bit of weight. So my BMI is under 50 currently. So he scheduled it for me, and I'm not really sure how I felt about that. On one hand, I'm grateful that he is doing it because I hope it's going to relieve my pain that I've been feeling for the last 2.5 years since I fell. But on the other hand, I have to admit that I'm pretty nervous about it. I'm really nervous about how much pain I'm going to be in and about how long the recovery is going to take. So I do have to confess that I am worried about it. So what they told me that they would be doing is the L2 through L4, they will be putting in a cage with screws above and below it. There will be a side incision, and then I'll also have incision in my back where they put the screws in. So I expect to have at least 2 to 3 incision sites. And I was told that I will be in the hospital at least 2 days. So I do have all of that information. So that's what I am expecting. As far as what I've done to prepare once I get home, I do have a walker at home. I also purchased a grabber off of Amazon, and I purchased another device that you use to wipe yourself when you go to the toilet, because you're not allowed to do any bending, lifting, or twisting. So I'm not going to be able to bend forward or backwards to wipe, so I did buy a device for that. I will link in my description the Amazon link for those 2 items that I bought. They will be affiliate links, just to disclose that they will be affiliate links, which means that I will make a little something if you choose to buy those. It doesn't cost you anything extra just because it's an affiliate link. So I feel like I am ready, or as prepared as I can be. A couple of other items that you might want to think about that I decided not to buy yet is a rail that goes under your mattress so that you can help to get yourself up out of bed. I'm actually going to be staying in my living room when I first come home because it's downstairs. My bedroom is upstairs at my house, and so I've decided I'm going to stay downstairs in the living room for at least a week after I get home. So that's why I didn't buy that. Something else I considered buying was a back brace, but then I decided that if my doctor wanted me to have a back brace, they would supply me one in the hospital, so I did not buy that. So that's where I am right now. So I want to let you know that I will be recording my progress. I plan to record going into the hospital and my admission and waiting for my surgery, and then I plan to record as much as I can after I come out of the anesthesia, of course, depending on how aware I am at the time. And then I'm going to record what happens at the hospital and then my recovery once I come home. So I'll be recording the days, weeks, and months coming up on my recovery. So if you are going to be having a lumbar fusion, then hopefully it will be helpful for you. So if you have enjoyed this video or you found it useful for you, I really appreciate you liking it. And I really appreciate you subscribing to my channel. As I said, I'm a new channel. I'm trying to get to my first 100 subscribers. So if you would subscribe, I would really, really appreciate that. So thanks so much for being here.